Hi, I'm Dr. Shilpa. I'm a gynecologist practicing at Bangalore. So today's topic for discussion is complications of uterine fibroids. So the uterine fibroids is a common tumor in the uterus of a woman, and this we see it very commonly in almost about 25 to 30% of women between the age group of 20 to 50 years. When a woman has a fibroid, in 50% of cases there will be no symptoms at all and there will be no complications at all. But in other 50% who come with symptoms, then we have to look and counsel about the complications also. So let us see as to what complications the woman might have if she has a uterine fibroid. So the complications usually depends on the size of the fibroid, and if it is usually more than like say 7-8 centimeters, then the complications are common. And the number of fibroids, if the fibroids are too many in number, like more than 5 or 6, even if it is like less than like say 2 to 3 centimeters, fibroids also can lead to complications. Also the location of the fibroid, if it is located say at the cavity of the uterus, then the woman may face more complications. And if it is located to a place where it is blocking the fallopian tube, or if it is pressing on the kidney or the ureter or on the bladder, then there may be complications. So the complications can be, one, it can increase the surface area of the uterus and the endometrial cavity. The bleeding will be quite heavy in such cases because of the increase in the surface area. So this happens when there are large fibroids which is close to the cavity, or even if there is a small fibroid which is jutting into the cavity called the submucous fibroid, that can result in very heavy bleeding during periods, prolonged bleeding during periods, and severe dysmenorrhea, and this can lead to severe anemia. So we see women who have these kind of fibroids come with always a hemoglobin of less than 9, and they will require iron supplements, they will require medications to improve their hemoglobin status. And this is something which I think the healthcare personnel should tell the women that see, look, I mean, your hemoglobin is quite low and you need to really up it so that your general quality of life is improved. After talking about the anemia part, so the other thing is like the severe pain which the woman will have when the fibroid is inside the uterine cavity, and she may require multiple doses of painkillers during the periods, or even like in between the periods, to tackle it. And taking multiple painkillers multiple times during a cycle is not good for the kidneys. So the other complications could be the pressure symptoms, wherein the fibroid can lead on to retention of the urine when it presses on the urethra, that is the opening of the bladder, or it can press on the ureter and cause swelling of that kidney, which is called as hydronephrosis. And sometimes this can lead to that heaviness in the lower abdomen, which kind of makes the woman feel like heavy all the time. So the other complications could be the changes in the fibroid which happens, which is called as say the cystic degeneration, or if the woman gets pregnant with the fibroid inside, it can lead to red degeneration and cause on and off severe pain during pregnancy. And very rarely the fibroids can lead to malignancy, which is the most dreaded complication of the fibroids. So does a fibroid twist, or does a fibroid get infected? Does a fibroid burst open inside? Usually nothing of this sort happens, and these are not the common complications, or these are never seen in a case of fibroid. So twisting of the fibroid, if at all, if there is a long pedicle through which it is attached to the uterus, is very rarely seen, but it is not a very common thing. So fibroid can be anywhere. It can be inside the myometrium, it can be inside the uterine cavity, it can be even in the vagina. So this can happen wherever there is a muscle cell. So from that muscle cell the fibroid can grow. So this is about the complications of fibroids, and I hope this was informative. Thank you very much for watching.